If you have a Medicare Supplement plan or you're thinking about getting a Medicare Supplement plan when you retire, you need to understand that state laws vary dramatically across the country. Medicare, the basis here, government Medicare A and B, is federal. It's going to be the same whatever state you live in. But your state Medicare Supplement laws govern Medicare Supplement, which is private insurance. And the law can be very different from New York to California. So this map shows you in the dark green the states that have a special law where you can change your Medicare supplement every year, regardless of your health. So I don't care if you're currently undergoing chemotherapy, if you have Parkinson's, if you have MS, you can change your Medicare supplement in these dark green states, but it's around your birthday. So it's called the birthday rule states, and it's changing. So look at the dark green states. Those states have had the birthday rule for at least a year. California, Oregon, Washington, they've had it for years. And they're all a little bit different. So some of them say the month that you have your birthday, you can change your plan to any other insurance company within 30 days. Some say 30 days before your birthday, up to 30 days after, 60 days. They're all a little bit different, so you'd have to research your state's birthday rule. Some states say, most states say, that you could change to similar plans. So if I have a G, I could go to another G with a competitor. Or if I have a G, I could go to a lower benefit. So you would go to an N. But most states, the vast majority, won't let you go from an N up to richer benefits, such as a G. And that's typically the movement that you'd want. You'd be like, I don't really like the N. I don't like these doctor copays. If you want to move up to a G in most states, even birthday rule states, you'll still have to pass the health underwriting questions. So what about these states that have the white and green stripes? Those are states where the birthday rule has been proposed, which means it's coming. It might be coming in 26, 27, 28, those rules. Remember, every state gets to set its own rules for Medicare supplements. So that's different in all those states, but it's coming. What will the birthday rule expansion mean to people on Medicare supplements? Higher prices. Because instead of charging healthy people lower rates and sick people higher rates, if they have to charge everybody the same rate or allow everybody to change their plan constantly, it will cost everybody more. So right now in a state without the birthday rule, such as Colorado, it doesn't have the birthday rule, rates are going to be maybe 1/3 of the price of New York, which has the most expensive rates in the state. In New York, you can change your rate, you can change your Medicare supplement every month. You don't have to wait till your birthday month. What's the deal with Missouri, right in the middle of the country being black? That is an anniversary rule state. If you live in that state, there's a period around the anniversary of when you purchased your Medicare supplement insurance policy that you can change to another plan regardless of your health. So this is something that is sweeping the country that is meant to help people that are sick that want to get out of an expensive Medicare supplement plan into a cheaper plan, but only during these periods. You can change your Medicare supplement at any time of year, at any time of the month. You could change it several times a month if you can answer the health underwriting questions. Well, Sylvia, what are the health underwriting questions? That will vary by company. Aetna, Cigna, Humana, Blue Cross, United Healthcare can all ask slightly different questions, and they do. They can change their questions. The questions last year were stricter than they are this year. It can be different, the questions that they ask the same insurance company that they ask in Nebraska than they might ask somebody in North Dakota. So it's a moving target. That's why we're professionals. That's why we've been doing this for 40 years. It's a lot to do on your own. If you have questions, you can email us, hello@themedicarefamily.com. Or if you just need an appointment because you're like, my Medicare supplement is too expensive. I want to know if I can change. Book your free appointment. Go to our website, themedicarefamily.com. There's a yellow box. Book your free consultation, and we'll tell you what's going on in your state, if you might be able to switch to a plan that the same benefits and cheaper. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.